important to understand the clinical relevance of some of these manufacturing techniques we've spoken about. I'm going to now give you a number of examples. We can see here a case of a patient who is completely edentulous on the top, i.e. they have no teeth, and we're going to use a complete digital workflow to create a new denture for them. This image here is from what we call an intraoral scanner. So this is our data acquisition in this instance. So the patient's mouth has been scanned, basically with a very complicated photo, which then creates a colour STL image of their upper jaw. We can then see that we've orientated their upper jaw here with a bite registration, and then we can now orientate their upper jaw scan and their lower jaw scan together. From this data now, what we'll do is we'll create a base for that denture. We can see there it shows a nice cross section through there, and then we'll set some teeth. So we'll digitally set the teeth. We can also integrate extraoral pictures of the patient. And we can see here, this is a digital representation of what the mouth should look like. And this is actually the occlusion that we're seeing in the mouth. So we can see very accurate result. The advantage to this for the patient is less chair time. Also, we can actually end up with higher quality end results. And if the patient ever loses the denture, which believe me does happen, we have the digital file there. So we can just mill or print another denture for them. Another clinical example of how 3D printing and additive manufacturing process works is this case here. Now we see a patient that is probably unhappy with their aesthetics, a lot of diastemas or gaps between their teeth, and they're showing quite a bit of gingiva here. This is the extraoral photo and this is the intraoral scan. What we're going to do is we're going to digitally modify the patient's gingiva. So we can see here, here's the original, and we're actually going to start to cut away the patient's gingiva here. We can do that in a way, as you can see above here, where we can now see the level of the gingiva at a perfect height when the patient smiles. We can also create some crowns. This is a really good technique because instead of doing the surgery and then hoping it's gone well, we can actually do the surgery in a specific guided way, and we can show the patient how they're going to look afterwards. In order to guide the surgery, we need to make a surgical guide though. What we're doing here is we're creating a file, we're creating an outline here. This will be about 2 to 2.5 mils. And then from that, we're superimposing their original, which is the pink area, to what we've designed the crowns to look at, which is now the yellow area. We'll then take that guide and we'll cut windows. So we can see we've cut a window here and a window here. And then this allows the surgeon to cut away those areas, the gingiva that they can see. And then it will actually show where the crowns should be perfectly.